Hey everyone, welcome to the Brain Body Reset Podcast. I'm your host, Spencer Zimmerman. Beyond the diagnosis and symptoms, there's a path to feeling better. Dive into the world of brain-body connection and learn how to optimize your health. For this week's episode, podcast number 4, I'm joined by a special guest, Dr. Michael Lewis. We discussed a variety of topics, including nutrition in the prevention and treatment of concussions and head injuries. This is part 1 of a 2-part series that will be released. Dr. Lewis is the author of When Brains Collide, what every athlete and parent should know about the prevention and treatment of concussions and head injuries. He is a graduate of the U.S. Military Academy at West Point and Tulane University School of Medicine. He is board certified and a fellow of the American College of Preventative Medicine and the American College of Nutrition. He's a retired Army colonel. He completed postgraduate training at Walter Reed Army Medical Center, Johns Hopkins University, and Walter Reed Army Institute of Research. Dr. Lewis is the author of When Brains Collide, what every athlete and parent should know about the prevention and treatment of concussions and head injuries. Dr. Lewis, welcome to the show.
Hey, it's great to be with you today.
It's great to have you. We get to talk about one of my favorite topics, and I'm really excited to chat about this, and that is concussions, but also what can people do to prevent it? But then on the flip side, what can they do, after they've sustained one? First, can you tell people a little bit about yourself and your background and how you kind of ended up where you're at as a medical provider?
Yeah, out of high school, I grew up in a medical family. My father was a small town surgeon. My mother was a nurse. But out of high school, I went to the U.S. Military Academy, West Point, and off to play Army for a number of years. And woke up one day and said, what am I doing? I always wanted to be a doctor. So I ended up going to Tulane Medical School down in New Orleans and back into, through the Army program and back into the Army surgical internship at Walter Reed in DC, and every intention of being a surgeon, but they sent me out to do general practice for a couple of years, and I just covered nights and weekends, and something that surgeons don't know much about, and ended up in preventive medicine and public health and a variety of different things, training at Johns Hopkins University, Walter Reed Army Institute of Research, which really was a focus on international infectious diseases. And my first assignment out of there, I got sent to Bangkok, Thailand. And for a number of years, I was running around Asia as a disease hunter, looking for new and interesting things. And then the Army said, you've got all this great experience, come back and teach medical students back in Bethesda at the Uniformed Services University, the military medical school. And while I was there, now Iraq and Afghanistan were going on. You got wounded warriors everywhere. And I kind of started to put different pieces of things together. Put 2 and 2 together, and I came up with an odd number. And I went to the head of research at the Brain Injury Center, Defense Veteran Brain Injury Center. I had to think of it there for a while because it's changed names over the years. The head of research there, and I asked, is anybody looking at the use of omega-3s like you get from fish oil to help our soldiers recover from traumatic brain injury? And he thought about it for a moment, and he said, no, why don't you? I made every excuse I could. I was like, I don't know anything about it. And he goes, but you're the only one asking the question. And so that was a massive career change. And that was 18 years ago. I've been on that path ever since. Retired about 13 years ago and continued that path even after I retired in private practice, running a small nonprofit, but always with the idea that there's more we can do to help people recover from traumatic brain injury, or even better yet, prevent them.
Yeah. So, so you said about, 18 years. So 2007, why? I guess that's one of the big things, why were you the first person asking the question about these brain injuries? I mean, at that point in time, the war had been going on for a few years, lots of IED blast injuries and everything else. Like, what was happening?
Well, you would think, and this was what shocked me. To me, it was almost common sense. I was an outsider. I'm not a neurologist, a neurosurgeon, a trauma guy. I'm a completely outsider, and I just, I kind of, like I said, I put two and two together, came up with an odd number. But one of the seminal moments was in January 2006. There was a mining accident in West Virginia where 22 miners were trapped in a coal mine a mile underground after an explosion. And it took them 41 hours to get down to rescue them. And by the time they got down there, only one guy was still barely alive. And it was a young, previously healthy guy. But methane gas poisoning, carbon monoxide poisoning, his renal function had shut down, had massive heart attack, all the things that would kill you. And somehow he was just barely alive. And so they did hyperbaric oxygen and dialysis and all these different things, but they were left with a guy that still had basically no brainwave function. And the neurosurgeon was prompted and called Barry Sears, the zone diet guy. And Barry Sears jumped on a plane, came down to Morgantown, West Virginia, and brought some fish oil with him. And they started pouring it down the guy's feeding tube. And short of the stories, a couple months later, the guy walked out of the hospital. And I kept hearing about this and hearing about this. Very different situation. But what struck me was, well, the brain is the brain. Wouldn't that work for traumatic brain injury as well? I call it my brick wall analogy. If you've got a brick wall, wouldn't you want to use bricks to repair the wall? Well, omega-3s, DHA specifically, but omega-3s are essentially the bricks of the brain. So why not back up a truck and dump a bunch of these DHA bricks into the site and help the brain repair? And I had absolutely no other thing to go on other than it just made common sense to me. And yet, when I looked into it, I was essentially the only one in the world besides the neurosurgeon in West Virginia who was even talking about this. And so I just kind of ran with it. To me, it just made sense.
Yeah, and there's a lot of things that we see in the concussion world that's now is starting to make sense. But in the past, it was criticized. It was like, oh, you can't rehab a concussion. What are you doing? And now it's like, okay, everyone pretty much agrees you can do something. Now, not everyone's up to really where they should be. But as we were talking about concussions, before we truly go into the whole fish oil and what it can do, one of the biggest things I've seen over my career, we go back a little bit of my backstory. My wife had concussions back from when she was a teenager in car accidents that were never diagnosed, never evaluated, and all of her symptoms were getting blamed on hormones, changing, oh, you're going to a new grade, it's puberty, and different things like that. So what are things that not only parents should be watching out for in their kids who are playing sports or, have been in car accidents, but also anyone should be looking out for, as concussions are so, unfortunately, still at this point in time, widely underdiagnosed?
They are, and it's really scary in many ways, but it's also the nature of the injury, right? It's the invisible injury. Guys in the NFL will say, I'd rather have my ACL blown out because everybody understands that versus, that terrible thing where you look at somebody, well, you don't look like you have a head injury because you don't see it. It's that invisible injury. And, even more scary is with kids. And so one of the things, and especially in teenagers, whether they're playing high school, hockey, football, rugby, soccer, basketball, name your sport. I'm a huge believer in team sports. I grew up playing football. I switched to rugby in college and beyond. I am on the board of advisors, the medical advisory board for Pop Warner Youth Football. I am on the board of directors for the National Collegiate Rugby because I believe in these sports. And team sports are hugely important. And the lessons you learn in life, where better to learn as you're growing up than through team sports. And unfortunately, collisions are part of these more aggressive sports, but can we make it safer is how I'm always looking at it. And we talk about different things like better helmets for football or lacrosse and things like that. But what we never have a discussion about, and it's starting, I'd like to think it's starting to change, but I'll back up for a half a second. If you look at the sports concussion conferences that have been held over the last number of years, the most recent one in 2022, it's the first time ever that they came out with a statement saying that exercise after a concussion is important. Before that, it was go sit in a dark room. And so finally, we're recognizing that exercise is an important part of recovery, but not a single word about nutrition. And to me, that's the biggest thing. We're talking about better helmets and better protection. What about protecting it from the inside? And really, the only way you can do that is with nutrition.
Correct. And it's sad that exercise was neglected for so long. It was just, hey, go sit in a dark room, don't do anything. And then as you've talked about, nutrition, it's still not even talked about in the consensus statements at all. There's no thought about like, hey, what you eat actually matters for your brain health. And
yeah, it's pretty scary that we're still that far behind.
It is, especially with like the research is there. I mean, it's one of the things, right? If we were just like, hey, you know what, we just are coming up with this, but the research is clearly there to tell you, look, this can impact immune system function. This impacts how brains develop. If it impacts how brains develop, then it can ultimately impact how brains function and how they can even repair. So for those parents who are, they've got their kids playing in sports, we've talked about, teams, and they're like, well, I don't want to pull my kid out of a sport, but I'm also worried that they may take a concussion. What like needs to happen for a concussion to occur, because it's not losing consciousness, but what are some of those myths that people kind of hold on to that they really need to let go, because by holding on to it, they're kind of doing more harm than good?
Right. I mean, there's a responsibility of everybody and anybody in and around and on the playing field, whether it's the referee, whether it's the teammate, whether it's the kid himself, whether it's a parent on the sideline, or the coaches. The more that people are aware and can keep an eye out for things. I've been at rugby matches where I've gone down to the sideline and yelled at the referee, hey, number 8, he needs to come out of the game, or she needs to come out of the game, because I saw it from the stands where, there was a blow and they're kind of wandering around trying to figure out where they are and then kind of get back into the game. They needed to be evaluated. So I think it's the responsibility of everybody that can be, and it's through education, right? So, I know as a kid, you weren't going to drag me out of a game. But we didn't know any better back then. And so I think that education is really important, not just for the coaches and the referees, but also the players. But also, sometimes you may be in a high school or college game. Well, not maybe. You should always have an athletic trainer at that level. But if you're talking about a 10, 12-year-old on a weekend soccer game, you're not going to have athletic trainers on the sidelines. So parents need to also be educated as well to be, and be empowered to pull a kid out. So the most important thing is get a kid out of harm's way. And so when there's an injury, you want to get them out of harm's way. You want to pull them out of the game. You want to have them out of a game, not just for that game, but for probably at least one, if not 2 weeks or more, where they're symptom free and allow the brain to heal. So what kind of symptoms should we be watching for? Headaches is a really obvious one, but some of the subtle ones, you've got a good kid that all of a sudden is a little bit more flying off the handle. They're a little bit more anxious. They're more angry when they were never angry before. They're losing their temper, and they never did before. So that volatility in their emotions, which in a teenager, granted, it's sometimes difficult to tell. But I've also seen instances where you've got straight A students who now all of a sudden are failing classes. That's a major red flag. And when they looked into it, there was a couple of concussions that the kid, once it was confronted with it, admitted, yeah, I probably, took a few blows to the head. So, things like grades falling off and just not, nobody knows a kid better than their mother, really. And so those are the kind of things that just those intangibles sometimes, not just the headaches that won't go away, not, and obviously you mentioned, like, you don't have to be knocked unconscious to have some major deficits following a concussion.
If you're finding this information valuable, please share this podcast with others and give us a 5-star review, as that is the only way this podcast grows. Please continue listening and keep enjoying. Yeah, and that's so important to know, as I'll get expert reports from neuropsychs, and they couldn't have had a concussion. They didn't lose consciousness. They weren't vomiting. I'm just like, this isn't even criteria. And the other
I know, I see that all the time from neurologists even. It's like, how can you call yourself a neurologist and actually put that in writing, that this patient could not have had a concussion because they did not lose consciousness? I'm like, how can you say that in today's world? It's absurd to me.
Absolutely. And the other thing is, with those symptoms you were talking about, behavioral issues, grades, and it's really important because it's not necessarily that you have to have every single symptom pops up immediately when the injury happens. We think about, like, you played football and rugby, I played soccer. How many times did we get banged up in a game? We finish it up, and then afterwards we're limping the next few days. It's like, look, as the adrenaline comes down, you can get symptoms that start popping up. And we see this in the NFL all the time, where you're like, whoa, someone's on concussion protocol. But during the game, they finished it up and everyone thought they were okay. And I want to go into, you'd mentioned, hey, if you've got these, you probably should stay out for 1 to 2 weeks. Now, you were saying 1 to 2 weeks, and that 1 to 2 week period was being symptom free for 1 to 2 weeks, or typically from the injury?
It's every single case is an individual and needs to be looked at that individually. And so ideally, you would want to be out for, roughly 2 weeks symptom free, but that's not always the case. And it also depends. Little league soccer is not the end of the world if you miss a game or two, right? And maybe not the emphasis in the big money game of, say, college football, but it's and the science seems to be changing a little bit more as we learn more, and so that progressive return to play type of attitude, modality, if you will, is really important. And so it's sort of like, crawl, walk, run, play type of thing. And, so that's where that exercise starts to come back in, is as you're pushing an athlete a little bit more, can they get up to game speed and still be symptom free? And that's a major, major criteria. I always think about, I have to think of it as just blanked on the name. He was the best hockey player in the NHL, best player in the world, probably about 10 years ago. Canadian.
Is it Sidney Crosby? Sidney Crosby?
Sidney Crosby with the Pittsburgh Penguins, right? And he had a concussion on 1 week. I think it was a Christmas Day, and then 1 week later on New Year's Day. And he was not kept out more than a week, and he really probably shouldn't have been playing that second match game a week later, and he had another concussion on top of the first one, and he was out of hockey for about 18 months.
Mm-hmm.
And everything I read, all that cognitive testing, all came back pretty quick. But what kept him out for about 18 months was when he would get up to game speed of skating, he had a slight issue with balance. That, we're talking about 99% better. And it was just at that professional, at that high elite level, that 1% at the end was all the difference. And so that kept him out of the game for, like 18 months, because when he was skating at full speed, game speed, he wasn't quite 100%. And so every individual should be treated individually.
Correct. Absolutely. Because symptoms they're really just misleading in concussion, because we know with the research, if you have concussions, your risk of other injuries goes up. There's also research that I've read in the past week or two that even showed on like single task or dual tasking, you saw increased activation in the brain with single, and then actually with dual tasking, the brain was basically fatiguing. But the kicker is the performance was considered adequate. It was like the same as someone who didn't have a concussion. And so it's kind of the same thing in the psych testing. It's like, well, they did good on the cognitive test. It's like, well, did they do good from what you could measure? And I think that's one of the big things that's still lacking in the concussion world is we have symptoms, we've got neurological based testing like eye movements and balance, but I don't yet have a great way to evaluate the oxygenation issues and then the inflammatory immune system issues, which I know we'll talk about those a lot as we dive into fish oils. It's really it's that immune system with concussions is what really determines your ability to recover short term, but then
as well as long term,
because what are some of those long-term issues? Because I know one of the things is you were involved with the military in a longitudinal study of traumatic brain injury. Was there anything interesting that was found there, or that you've just learned in your other research and observations on the long-term effects of traumatic brain injuries? And I think we should note that concussions are the most common form of traumatic brain injury. And we've got to let that old stigma of like, oh, well, a concussion's not a TBI. It is the most common form of TBI.
Right. It just, you don't want to worry a mother too much by saying your kid just had a traumatic brain injury. So we soften the blow, call it a concussion. And it is a traumatic brain injury. So you're right. That's one myth that we've got to certainly try to dispel. And there's plenty of others, that's for sure. But interestingly enough, I'm just thinking about the recovery aspect of things. And it's funny how things come about. Out of University of Toronto a number of years ago, they were doing a study, and what they found, it was just observations. And what they found was that the teenagers that ignored the advice of go sit in a dark room and don't do anything until you get better, the kids that ignored the advice were getting better faster. And somebody realized this, and then that is how the whole exercise thing started out. Because, well, okay, if they're not just sitting around doing nothing, what if we exercise? And so it carried on from there. It was probably, almost not 15, but probably about good 10 plus years ago. I was talking to the head of the program at Stanford, MD, PhD, neurosurgeon, inventor, entrepreneur, the guy that started the Brain Trauma Foundation, sets all the standards for acute care and brain trauma. And I was asking him, I said, so what do you do with the athletes? And he goes, well, when I have an athlete, he was the head of the Stanford University program. He goes, when I have an athlete that has a concussion, I put them on a treadmill the next day. And I'm like, okay, well, what if they have a headache? And he goes, kind of jokingly, but not so much. And he said, I give them a Motrin and I tell them to keep running. They're athletes. They just get better so much quicker. And that was like 10, 12 years ago, way ahead of his time. he goes, so he started, exercising athletes within a day after a concussion, just not putting them back into the game, but getting their heart rate up. And so, you need that blood flow, you need the adrenaline that helps healing. But the other thing, just in this last year, that I thought was interesting was a similar study came out, like the University of Toronto study, and it showed that the kids that ignored the advice and went back to school sooner got better quicker. And so that has changed now the return to school aspect of things that were, if you're following the most current research, kids should be getting back to school sooner, with one minor, well, not so minor, but one exception is that they should be limiting their screen time, but they should be back into school with accommodations, because the quicker they get back to school, the quicker they recover. And so this idea of go sitting in the dark room, no screens, no this, that, or the other, take away the phone, that's how kids communicate. And so, you're taking away their communication. You're having them sitting at home, not doing anything, not on screens, and not communicating with their friends. So no wonder they're not getting better, because now you're throwing almost, the prerequisite for depression on top of things, because, we're human. We need socialization. So all these things go together towards helping to recover.
Yep, absolutely. I always tell my patients, screens, our brains were not meant for the screens. I have them. I'm like, look, you got to get printed material. Let's do as much of audio as we can. But screens really hurt quite a bit. And then the other part you mentioned, right? We do know, based upon the research, if someone has depression heading into a concussion, it's going to take them longer to recover in general. Or else if they develop depression because they're isolated, that also is going to prolong symptoms. And with what we've talked about with exercise, I'm going to ask you to put out just a few little guidelines, because we know people who are listening to this or watching it are going to say, all right, well, I can't have my kid doing nothing. Let's get them active. Do you have just a few little tips of ways that parents can do it, or maybe a coach could do it for their kid, their athletes, to be able to get some sort of physical activity without being like, oh, that was the worst advice I ever took, I was in a flare for a week?
Right. Well, and I can't give specific advice. So, nor should you, in this format, but so you should work with the treating physician, but it's that crawl, walk, run type of thing. And so that's that return to play progression, where at a minimum, it doesn't matter with a teenage athlete or a 56-year-old, that slipped on the ice or was in a car accident. You need to exercise, and you need to, even if that means taking a walk around the block. And so, maybe you can walk around the block once and then you feel wiped out. Okay, that's fine. Good for today. Tomorrow, try it again. See if you can walk 2 blocks around 2 times around the block. So you want to, I always tell my patients a mantra is push yourself, but don't hurt yourself. So you want to push the limits, whether it's screen time, reading time, exercise, whether that's measured in mileage or minutes. You want to push yourself, but not to the point where you feel worse. You want to push yourself up towards that. And there's more scientific ways to do that. A great way is by heart rate. And so if your heart rate, your resting heart rate 60 and you're young, so you could get your heart rate up to 200 if you're running at a full-on sprint. So, but now you get your heart rate up to, say, 120 and you start to feel terrible, headache and dizziness. And so now, well, that's my threshold. Don't let your heart rate get that high. So, maybe get up to 100, kind of keep it there for 10, 15 minutes, and then back off for the day. And that threshold is going to get better and better and better as you go on. But even an elderly patient, I always tell them, the most important thing you can do and I prefer outside because I want fresh air and sunshine, hopefully. But go outside for a walk, and like I said, whether it's one time around the block or, 3 miles in the woods, great, but push yourself a little bit. And, if we're talking about more of an athlete and a kid, okay, so now you can walk, you can walk at a slow pace for 15 minutes. Good. All right. Now you can walk at a fast pace for 15 minutes. Great. All right. Now what can you do? A slow jog, so you're picking up the pace to jog, and then you're getting a little bit more running. I love sending kids back to practice as long as there's no contact, right? Even if it's go to your soccer practice and you're not participating at all, anything, you're just running around the track on the outside, but now you're at least feeling like you're back part of the team. You're involved in the team meetings and things like that. But then all right, then you're doing some drills, no contact, right? And you work up to that. So you go from the walk to the jog, to the run, to the sprint, to the game speed in practice before you get back to getting back into the game.
Yep. Yeah, that socialization component is so important. And then, like I said, anything is better than nothing. You don't want to flare up your symptoms, but, don't be so scared. Like, I love stationary bikes. I'll tell people, look, just do 3 minutes, 3 to 5 times throughout the day. Don't try to do 30 minutes all at once, right? Just view it as like you've got to sub yourself out of the game. That's okay. And like you said, right, if you find at this threshold you have issues, I typically tell people do 80% of what causes an increase of symptoms.
Exactly.
Right? So you said 120, right. Hey, do 100 and tolerate it. Cool. Then you can go up. And, and this is where having a great healthcare provider that you're working with is really important, because they can help coach you along the way, because there's a variety of factors that are going to impact how well you recover. And this is the conclusion of part 1 on this 2-part series on concussions and fish oils. Part 1 was primarily about concussions and what you should know, while part 2 we dive much more into fish oils and the role in helping individuals recover from concussions. That will be released in 2 weeks as episode number 6. Enjoy. If you have found the material valuable, please subscribe to my YouTube channel, Dr. Spencer Zimmerman, and leave us a 5-star review on Apple Podcasts or where you normally listen to podcasts from. If you would like to work with me, visit peakbrainandbody.com to learn more. You can find me on YouTube, Instagram, Facebook, or TikTok, all with the handle Dr. Spencer Zimmerman. I'm also on X with the handle Dr. S. Zimmerman 5. This podcast is for general information purposes only and does not constitute the practice of medicine, nursing, or other healthcare professional services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials are to be used at the user's own risk. The content on this podcast is not meant to be a substitution for medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they have, and should seek the assistance of their healthcare professionals for any such conditions.